caveat or silver lining. I'm still here to experience them. So, you give and you take.
So the radiation caused your ribs to break?
Yeah, they cause them to weaken. Point where little things can break them. So I've broken my ribs by sneezing. One person accidentally hugged me too hard and broke my ribs. So it doesn't take much.
Hello, and welcome to Breast Cancer Conversations, a podcast brought to you by survivingbreastcancer.org. I'm Laura Carfing, breast cancer survivor and founder of survivingbreastcancer.org, a nonprofit organization providing community, education, and resources to empower those diagnosed with breast cancer and their caregivers from day one and beyond. Welcome, everyone, to another episode of Breast Cancer Conversations, podcast where we talk about all things breast cancer. And today I'm really excited because we are joined with amazing women who are going to share their experiences living with metastatic disease and then specifically undergoing radiation treatment. It's really interesting because when you think about radiation treatment in the metastatic setting, it's like a really big umbrella. And just to contrast that with my personal experience with early stage breast cancer and having radiation, it was definitely as part of like the chemotherapy, the surgery, the chemotherapy, the radiation plan, which I think is what a lot of us hear. But in the metastatic setting, it can be utilized in very different ways. And also with different technologies and treatments and goals and outcomes. So we definitely want to highlight those experiences today. So thank you and welcome, Kacie, Sara, and Joyce. Welcome to the conversation. Sara, let me start with you. Where are you calling in from? Tell us a little bit about yourself.
I am in Omaha, Nebraska, and I was a teacher for, 20 plus years. And every grade from elementary to college age graduate teachers and loved it. And then diagnosed in 2017 with stage 2B and then again metastatic in 2022 to the brain. And so then for the 2 years after that, life was not pretty and I left my job. I had to leave my job after that. So here we are.
Thank you for sharing. And since we're talking about radiation today, and given my quick intro, did you end up having radiation as part of your early stage diagnosis?
I did. I had radiation as part of my early stage diagnosis and, to where my tumor was in my breast. And then I ended up having it again to the brain as part of my treatment after it had metastasized to my brain.
Yes, and we'll definitely dig into that. Thanks for that clarification. Joyce, what about you? Would you like to introduce yourself and where you're calling in from today?
Sure. My name is Joyce, and I am actually transplant to Northern Indiana from Southern California, and it's quite a ride. I was a public health nurse for 25 years in the Los Angeles area. I worked in Pasadena. And then for the county of LA. I was diagnosed early stage in 2012. I don't remember the exact stage, but it was like a 1 or a 2. It was one of those things where it's like, yeah, try not to think about this too much and just get through it. And the hardest part of it was the radiation, actually. It was exhausting. And I would be sitting in my chair at work and like nod and off. Yeah. It's not a good scene. But I did get through it. And I don't remember them saying anything about progression or metastatic disease. So I just kind of, tripped off on my way with my, little bouncy step and kind of forgot about it, to be totally honest. And then in 2023, I actually had a CT for left flank pain, which ended up being diverticulitis, but they didn't find it. They didn't find the diverticulitis. They found the metastatic disease in my bones. And I think I kind of freaked the radiologist out based upon the report. So that was interesting. I didn't have any symptoms. Well, that's not true. I had puckering on the top of my breast that somebody should have, actually discovered on mammogram, and they didn't. I did end up having a doctor that put through a diagnostic a couple times, and they finally took a closer look and found the tumors, the breast tumors, but then also the metastatic disease had already been discovered on the PTs. So
like psychological piece of people thinking it's easier or at the end or you got through chemo. But I agree with you. The fatigue and the compilation is not the word I want to use. But be going Monday through Friday again and again for weeks over weeks, it compiles, right? And so the compound effect. So like by the end, you're just exhausted.
Well, and silly me, I was trying to work, right?
That.
So in order to be able to have a long lunch, you have to show up at 6 o'clock in the morning and stay until 6 o'clock at night. So that doesn't help anything either. So, right? What we put ourselves through.
Absolutely. Kacie, what about you? Where are you calling in from? Would you like to introduce yourself?
My name's Kacie Flaherty. I also live in Nebraska near Sara. And let's see, my journey is complicated. I was diagnosed de novo metastatic in 2018. I had 4 centimeter masses in my liver and 2 smaller ones the 2 small ones were dealt with cryoablation, and I had SBRT to the 4 centimeter masses in my liver. And then because I was oligometastatic, meaning it was only in my liver, I got to do curative intent. So I went through the early stage course. So I did the chemotherapy, I got surgery, and then radiation as well to the breast area after surgery. So I've kind of got a little bit of both sides, if you will. I've been lucky enough to have been no evidence of disease since the surgery, and I've maintained my first line of treatment since then. So doing well, holding on, and happy to be here and to share my experience. Hopefully it helps someone.
Thank you. And that's a really unique experience as well. Can I ask you how you discovered that it was metastatic in your liver? Were you having like pain or other symptoms?
It turns out I was having classic symptoms that I didn't know were classic symptoms. They initially told me I was 2A with a 4 centimeter mass in my breast, and the multidisciplinary team approach that my center takes, they were asking lots of questions, and my oncologist asked if I had any bone pain anywhere. And I was like, well, I'm playing high-level rec league volleyball. My shoulder hurts and I've got a rib that keeps going out, but I am throwing myself on the floor, right, to play volleyball and swinging. So it makes sense to me that these pains are there. And that turns out rib pain with radiating shoulder pain is a classic symptom of liver metastasis. I did not know that until several years later when one of my friends shared a MetaViber fun fact during October, so Awareness Month. So I did have some pain, but I didn't know. So I wasn't attributing it to that. So.
Right. Or even making the connection that like shoulder pain or rib pain, you would think maybe metastasis to the bones versus the liver, right?
Yeah. Yeah.
So very interesting. And then being able to go through what you were calling like kind of the early stage treatment plan with curative intent. And so we'll definitely talk a little bit more about that as well and how successful your treatment has been, especially with the cryoablation and the SBRT. I had to look at my notes there, the SBRT treatment. Wonderful. So actually, Kacie, if I can just continue the conversation with you. So when you found out then your doctor is asking all of these wonderful questions to try and figure out, assume like what test to order and the extent to which the cancer may have progressed, how was your treatment plan presented? And so you did mention, chemotherapy and surgery. At what point was radiation brought on to that sequence?
Initially, they wanted me to just go on clinical trial that was a investigator-initiated trial, so it was a local trial here that would have put me on Ibrance and tamoxifen. And I argued and fought with that. I wanted more. I knew I could handle it. I was diagnosed at 35, but I was fairly healthy. So I had what I thought was plenty of effort to give. That caused my physician to take it back to the breast-specific tumor ward, again, at the local hospital here. And I think it was a little lost in translation because when he called back to tell me the plan, he said, well, I was outvoted. So I don't think he meant it that way, but it definitely came in at that point where they said, okay, here's what we're going to do. We can do cryoablation, which will go in and take these small tumors out because by then a 4th tumor hadn't popped up in my liver that was very small. And then we're going to use SBRT on the large liver mets. It's high dose, so you're only going to go in 5 times. And then we're going to try this curative intent where you're going to go through chemotherapy. So basically, I got what I wanted. Okay. Yes, so the 4th met popped up. So they were going to tackle that with the cryoablation. And then we were going to do the SBRT to the large liver mets and then proceed into the early stage curative intent treatments. And so, started fairly early. The SBRT was high dose, so it was only 5 sessions. But like Joyce mentioned earlier, it was definitely exhausting to go in and do with. And I got lucky and scheduled mine right at the beginning of my workday so I could just stay longer to pick things up. But yeah.
And SBRT, is that different than other types of radiation?
I think it's high dose. So I think it
High
stands
dose,
for
okay.
stereotactic whole body radiation, or not whole body, stereotactic body radiation therapy. And I believe it's higher dose. So that's why it came in 5 rounds instead of the multiple rounds that early stagers get. And because my tumors were right up against the ribs, they did not try to spare the ribs. So I do, as a result, kind of have permanently broken ribs. But as a caveat or silver lining, I'm still here to experience them. So, you give and you take.
So the radiation caused your ribs to break?
Yeah, they cause them to weaken.
Okay.
To a point where little things can break them. So I've broken my ribs by sneezing. One person accidentally hugged me too hard and broke my ribs. So it doesn't take much. And I'll be honest, on my scans now, they are referred to as a deformity. So I think they keep trying to heal, but they've been broken so much that it's just sort of laying down bone cells everywhere.
Oh my goodness. Are you?
Sometimes when they re-break, it is painful for a little bit, but I don't know if I'm just used to it now or if it's just sort of rounded off the edges and become a little less sharp of a pain. But
yeah,
and not most of the time I'm not in pain, but I still get it. Yeah.
Definitely. And Sarah, were you going to chime in with a question? Yes, I know. I feel like in the world of breast cancer, we have all these acronyms for everything. And so, that vocabulary and alphabet soup we have. So transitioning then from this high dose radiation treatment for your liver, Kacie, Sara, I would love to explore a little bit more about your experience. You were talking during your introduction about being diagnosed with early stage and then finding and discovering that you had mets to your brain. Do you want to tell us a little bit about how that was discovered and what the treatments look like?
Yeah. So like several other people went through, and Laura, probably you went through the normal process of, your chemo, your radiation, surgery for a lot of people to remove a lump, whatever. And then went along my merry way, like Joyce said. But then I was counting down, everybody says that 5-year mark is, if you hit that 5-year mark, then you're supposed to be free and clear. And so I was kind of counting down to that 5-year mark, and I hit that 5-year mark and was so excited because I was still clear when I got my scans. Well, they don't scan your brain when they do those scans because that radiation is not the best for your brain. So when I was at work, I had a seizure and I had a grand mal seizure, and they took me to the hospital and turned out I had I think it was 2.5 centimeter and a tumor in my brain. And so the treatment basically started out, of course, was getting the tumor out. That was number one priority. And then the second was dealing with infections that kept popping up around that, so much so that they ended up finally having to haggle with the radiation doctor about starting my brain radiation. But then I ended up having radiation, I think it's gamma knife radiation that they used to the brain. So it specifically targeted just the area where the tumor was in my brain, and as opposed to a whole head of radiation that some people get. And that I had to come in, if I remember correctly, I had to come in 13, I don't think it was that many, 13 times, 7 times maybe. And they lock you down. They have a face mask that is molded to you and with plastic, and lock your head down so you can't move your head, and you have your cancer session. They play really whatever kind of music you want, and so you just stay nice and still during the treatment. And so
Is the treatment itself like short, or
if I remember correctly, it was about 20 minutes.
That you're lying in this position with like the mask on?
Yeah, you're lying on a table exactly like a table that would be like an MRI or a CT sort of table. But it does have the ability to lock your head and this mask down to the table so that you can't turn your head or anything like that. So that it's, I had to go in and get it tested so that they made sure that they knew exactly where they were going to hit with the radiation. And that took a couple of appointments to do that and make sure they knew exactly where they were going with that.
So when someone's telling you that you're going in for gamma knife radiation to your brain, what is going through your head? And did they explain to you what the process was like, that you were going to go in for these like moldings to get the mask and the fitting and the mapping. And what do you say to somebody like myself who is like claustrophobic and would be horrified to be nailed down to a table?
Yeah. So they explained it to me. And, in some ways, I kind of understood it because you do similar sorts of things in early stage when you're doing radiation. You're just not locked into a mask when you do it. And so I guess I understood it in that regard. Feeling wise, it's very scary, obviously. And just knowing that you had a tumor in the brain to begin with is scary. So you're dealing with that on top of everything. And in some ways, everything's moving so fast that you don't really quite understand at all. In terms of what I would say to someone, I'm not entirely sure what I would say to relieve the pressure other than, talk a lot to your doctor, talk to people if you know who have had a similar sort of process done as well, so that you have that. And, if you are doing that process, see if you can have, I made a specific playlist of very relaxing music so that when I was in the machine, they would play that music that just kind of really brought me to a calm space.
That was not the same experience.
I had a similar sort of experience recently with my last brain MRI. They put me in a completely different, I had to go outside of the building into a traveling trailer. And
yes, they have a trailer outside too. Yes.
It was like March and it was cold and they didn't tell me I was going to be in that. So I didn't have a sweater. And it was not a great experience. That one wasn't.
No,
I'm glad you asked, Laura, because when I had some brain MRIs to check for metastasis, luckily wasn't there. I have them put paper towels over my eyes. So that way, when I open them, I can't see anything.
Yeah.
I can't focus on how close that is to my face. Sara, when you did that, was there anything could you have put something over your eyes like that with that screwing you down to the table?
I don't know, because of the way the radiation was going to hit to my head. I don't know that they could have put anything over. Maybe they could have put something here, but the mask, I should have grabbed the mask and we could have had show and tell. But the mask is pretty large. And so, so I don't know if I could have. It is perforated and it has holes. So it didn't make it feel like it was completely closed in, but I don't know if they could have put anything there because of the way the radiation was going to.
I want to take a quick moment and tell you something I'm really excited about. You can now download the survivingbreastcancer.org app directly from the App Store or Google Play. Just search for survivingbreastcancer.org. It is completely free to download, and inside you will have access to all of our support groups, educational programs and webinars, all of our blog content and articles, podcast episodes, and community features to connect with others who understand what you're going through. Everything in one place, because navigating breast cancer shouldn't require 15 open browser tabs. Download the app today.
Yeah. Something to think about if it ever comes to that in the future, I guess.
Yeah.
Our way through something like that.
Yeah. I debated about whether to throw it away or whether to keep it as a souvenir.
Absolutely. Well, thank you for sharing that. We'll definitely come back to this. And for any of our listeners too, if you have any hacks for getting through claustrophobia in all of these situations, definitely let us know. We would love to hear your recommendations. So Joyce, let me turn things over to you about your experience with radiation, because unlike Kacie and Sara, it sounds like yours was more from a palliative perspective. And I would love to hear a little bit more. Those decisions were made with you and your doctor and where you had the radiation and what the results were like. There you go.
Thank you. I mean, if you don't mind, I'm going to just make a quick comment for Sara and Kacie.
Oh, please.
I just have to say, I admire you ladies greatly, especially with that mask thing is a no-go for me. That's just, if I ever have to have that kind of treatment, it just won't be able to happen because I'm like you, Laura. I am. But yeah,
And so this was for an MRI test that you were going to have, like it was planned and scheduled to get the MRI. And when you showed up, you were like, oh, absolutely not.
Mm-hmm. Yeah. And I've never I mean, I'm a nurse. I don't turn down exams on a regular basis. It just really looks bad. You know what I mean? And I also have a very high pain tolerance and a very high, I mean, I grew up overseas. I have a high pain tolerance. I have a high tolerance for all kinds of strange things, but that was just more than I could do on that day. So yeah,
Yeah.
I'm going to have to figure something out because I'm concerned, obviously. And so is my doctor, but not that day, not that way.
And what do you think doctors or nurses or, from an education perspective, when someone says you're getting an MRI or a CT scan, like they don't really explain what it is. You're just like, okay, it's just like a thing on the box and you show up. I wonder if there's a way for getting more like description around, because in the medical field, these things roll off their tongue. This is what they do. This is what they prescribe. This is like the steps that we're doing to like work up a diagnosis or anything like that.
And I don't
but for us, it's the first time.
Yeah. And I don't think, this is my opinion, so I'll say that first. I don't think doctors pay attention, probably because they don't have the time. But I would hope that somebody on that team, right? Even if you have a little tiny team, because you're in a rural area or whatever, somebody on that team should know, in my opinion, what their machine is like. So if somebody calls in and says, hey, I'm horribly claustrophobic, can you prescribe something for me to calm me down? And then can you describe to me what the machine is like? I wouldn't have walked out. I mean, I would have said to them, we need to find another machine. Now, and even, I mean, I live in a rural area, but the hospital system that I'm being treated for has hospitals in every little tiny town.
Request that I don't be placed in, they called it the mobile unit. And I will, when I have my next one, I will say not in the mobile unit. So, yeah. So I think you, unfortunately, sometimes have those experiences and then go, oh, okay, now I know what I don't want.
Exactly.
What I do want.
Fortunately, I had already gotten some relief. And over time, I got complete relief. I haven't had any additional problem with that hip other than what happens to old people with arthritis when they get their body in the wrong position. Okay, hip's not going to do that. Let's try this again. But it's not any worse than it was, before. So radiation in my book, palliative radiation in my book works really well. So I would, if you need it, try it.
Yes. Tell me a little bit more about it presented to you. Have you ever heard of palliative radiation before? And how is it presented in terms of like, and because again, being novice to some of these topics, if someone's like, oh, we're going to give you radiation to reduce pain, I don't connect those dots. I'm like, how is the radiation going to reduce my pain? So how is it explained to you? And why were you like, okay, yes, this is the best course of action for me?
I believe it was my palliative team, my dual palliative team. Anyway, I have a nurse practitioner that is the head of my palliative team. And she's pretty on the spot. She knows a lot. And she was the one that suggested it to me. So then I talked to my oncologist about it. And they're like, yeah, I also have an orthopedic doctor and a PCP that all would have prescribed it if I requested. I have these wonderful doctors that if I present a decent case, they'll do stuff for me. I just love them. I looked it up because I was the same as you. Radiation for pain? And then I talked to, my first appointment was an introduction appointment, not an actual treatment. And the radiologist that works in this particular area is also very, very sharp. And he explained the whole thing to me. So what they do with the radiation is the same thing that they do with radiation for treatment, only it's more targeted and it is a higher dose is the wrong word, but they turn up the volume on it. That is so non-technical. But essentially that's what they do. It's more targeted and it's more intense, whatever the scale is that they use in radiology, which I don't know. And essentially it's the same thing. They're attempting to shrink or heal the mets, which on a bone, looks one way and on tissue looks another way. I don't know that they use it for soft tissue. It may be a bone only thing. I'm sorry, I don't have that information. I just didn't pay attention to that part. But my suspicion is that it's used as palliative bone.
Well, I'm glad you're finding relief from it. And so
it was amazing.
that's great.
Yeah. I mean, I was like, oh my goodness, what am I going to do if this doesn't get fixed? Right. And it was
Totally.
actually very quick. It doesn't always work that fast. So I was lucky. But yeah, it's a go in my book.
Excellent. So, with the 3 different stories that we've heard about radiation therapy, I'm curious about the side effects that came with. So, Sara, can I turn things over to you? So, you had radiation for the brain. What type of side effects did you experience? And also acknowledging that not everyone gets all of the side effects that may come with some of these treatments. But what were you expecting and what was the reality?
Again, some of this is hard to disentangle because of the surgery and the seizures that I had along with it, because I ended up on seizure med with it. But
And I think that's really natural too, right? We're on so many drugs and treatments. You're like, I can't pinpoint something, but this is what's happening.
Yes, I would say that the biggest side effect, besides being tired, like we have with all radiation, I think, is also I lost my hair to all that spot that was radiated. So I was kind of like a skunk for a while until I finally told my hairdresser, I'm like, just shave it all off. And so yeah, just get rid of it all. So being tired and losing hair were 2 of the biggest things. And then, of course, because mine had also been cutting out the tumor, I had staples in my head for quite a while. And even when they had to do, Kacie, you might be able to tell me which one of the scans they had to like roll me over on my side. And I can't remember. One of the scans, they had to roll me over on the side and do the scan, but they had to roll me over specifically on the side that had my staples. And that was obviously very unpleasant. And so just those things like the wound and dealing with the wound and being tired, those are the biggest side effects that I dealt with.
Yeah, I'm curious. So about losing the hair, did they cut any of your hair prior to doing the radiation, or were they able to just go through the hair and then it just got thinner?
A strip.
They cut a strip.
They cut a strip during surgery, and that was, so that they could get in there and cut out cut out what they needed to cut out to get to the tumor and remove it. And then they left it. So during my stay in the hospital, I had hair on this half and a little bit of hair on this half, and I looked terrible. And then when I got home, I kind of tried to put it up in ponytails until my hairdresser could take care of it and just shave it off. So yeah, they did what they had to do to get to the tumor, but they didn't shave everything off. And I guess that was a choice they left up to me. But kind of, and like, why didn't you just shave it off?
Yeah. Kacie, what about you? What were some of your side effects, if any?
Well, from the high dose, from the SBRT, I ended up having a rebound reaction. So because of the order of events that they went through, when I started the chemotherapy for the early stage treatment, it caused the skin in the area where they shot the radiation into my liver mets to react. And it got very angry. It happened to be kind of right on the brow line. So it made it really tender. And so we had to treat that with an ointment that the radiation oncologist gave me for a couple of weeks until that kind of calmed down on its own. Other than that, it's just the normal scarring that kind of comes with radiation. So my lumpectomy gals will understand that after they radiate the breast, it kind of stays where it's at and it doesn't really change or expand as you do or shrink. So I kind of want to mention that for what Sara had just mentioned. We have a couple of friends here locally that have had whole grain radiation, and they complain about the hair loss and how they just are waiting for their hair to grow back. And we spoke to an oncodermatologist about it, and he mentioned that scar tissue is really common for radiation. So that's part of why their hair isn't growing back, is because they now have scar tissue on their scalp kind of all over. So not only do our meds make it thin, but the radiation in their cases certainly didn't help. So,
and I would also add that probably many of us are on some sort of menopause type, suppressing estrogen, proestrogen, whatever drugs, and those aren't helping the hair issue as well.
The hair or the skin or anything.
Right.
Yes. He is looking fabulous. And Joyce, what about you? When you were getting radiation with palliative intent to help with your pain, was there any like redness or skin discoloration or other side effects that you had to manage?
Yeah, there was two things I was going to say, and I forgot the first one. So we'll go to the second one. Oh, I know what it was. It depends. It depends upon where they radiate, right? That makes sense. So with my hip, they were radiating right around the center of my body. Just thing turns, 180 degrees around the center of your body. So that hits intestines, which means you end up with diarrhea, multiplied, right? So if it's a heavier beam, just think about the diarrhea you had when you had the initial radiation with your breast, and it's basically like that. It was completely uncontrollable. I was introduced to, actually, I should say this because it's interesting. I was introduced to adult diapers, and something that I didn't even know, and I've worked in skilled facilities and stuff, there is a level of function and a level of I have just hit a new low and what that does to your brain and how you have to process that. Okay, so this may now be a new reality for me. Now, fortunately, my poor little GI system recovered and I was able to discontinue that. But it is a thing that when you meet somebody who has severe GI distress or severe GI side effects, that they may now be experiencing and having to deal with and interpret what it feels like to be a more compromised individual. So that I'm just going to put that out there for people who are supporting, people or just for general information. So that's what I had, very severe GI side effects. Now, what I didn't know, but radiation burns, right? It burns our breasts when we have it on our breast. I ended up with, and this was so much fun, not fun. I ended up with burns with I think they were second degree burns because they were blistered in the space between my abdomen and my upper leg, which is a space that's hard to get to on someone who has extra weight anyway. So I actually ended up asking for a referral to wound management.
And Joyce, the doctors did not notice, or the radiologists and the nursing team did not notice that, or
well, the
tell you about
radiologist
that,
wouldn't have because he never saw me unclothed. And the radiology techs as well. Let's see, did I even change into a gown? No, I was instructed to wear clothing that didn't have any metal on it. So I was just dressed in sweats. And so, yeah. And yeah, they didn't, it's more of an outpatient procedure. So that's more of their frame of reference, right? You don't have a nurse that's part of the team that's looking at that. Fortunately, I knew what I was looking for, but I can imagine that if you're not kind of tuned into that, you wouldn't know. That's kind of a scary thought, but I could understand how that would happen.
yeah.
My primary care doctor.
Joyce, that reminds me, I got burns on my breast. I also got burns on my breast during the after the surgery treatment, and mine came on sort of like a slow sunburn, if that makes sense, like those additional little doses. And they gave us the cream to put on to kind of keep the area moisturized. And I was a dum-dum and didn't think about them doing the axilla area. And so that was where my sunburn ended up, or my burn ended up was in my armpit. So I think even though the radiation techs were looking at me every day, it was such a slow burn that it kind of came on towards the end or kind of afterwards. So it was just maintenance therapy after that. So, I mean, Joyce, you said 5 doses for your hip. They may not have seen it coming, even if they were checking. Just a thought.
And I was very much the same, that mine crept up and they stopped whatever level of dose that they were doing. They took a break and did this was for my breast. I stopped that and then switched to something else and then went back to my breast. But the name of the cream, and you can probably get it in others, but the name of the cream that we used was Silvadene. And so it was very effective for breasts. It'll probably be effective for other types of external cancers that you're getting treated.
And I'm curious, Kacie and Sara, when you were getting radiation on your brain and liver areas, were you also being prescribed creams and moisturizers?
I was not for that. No, we used Aquaphor locally, and I've heard other people use emu oil. Not that I know what that means, but I've heard people praise about it. So other options for them. But
yeah, and in fact, I was told because of the infections that I had on my head as well, I was given lots of instructions not to use a lot of things on my head and where those staples were and that kind of thing.
It was a pain. Yeah, I think all you guys are about. Yes. Okay. Dramatic pause. So Joyce, why don't we start with you, and then we'll have Sara and then Kacie.
Yeah, it was more of, I remember it was more of, practical, right? It was more of a practical, oh no, you gotta figure out how to make this shorter or, yeah. I don't remember at that point, of course, I was pretty overwhelmed already, feeling, oppressed, but it was just more of an annoyance and please, can we just stop and be done with this? So.
Yeah, absolutely. Sara?
For me, it was scary because, I had already gone through all the stuff with breast cancer. So I had in the breast itself and had already known that process. This was an unknown process and we had done the surgery. So it was kind of like, okay, this is a big deal between the surgery and the radiation. This is a big deal. How is my brain going to recover? What are my chances of recovering? And me as the librarian assistant professor that I am, go and read a peer-reviewed article on the rates of survival after these surgeries and seizures. Should not have done that. Don't do that, people. Especially if you don't have the scientific knowledge to read it. But yeah, so it was scary and overwhelming, and especially knowing the two different issues I had going on between the surgery, taking the tumor out of my head, and then the radiation into my brain.
Yeah. I'd say my first experience with the SBRT, I was actually excited. It was the first thing we were doing to tackle the cancer. And I was like, I'm here for this. Let's get it going. Let's start killing cancer. And plus it was 5 doses. So it was pretty easy to handle. I did deal with the exhaustion, but emotionally speaking, no, I was ready to go. I would say when it came to the breast radiation towards the end of my years long worth of treatment, I was tired. And so it was like, okay, one more thing. But I had that first reference of knowing that physically it was going to be just show up, you lay on the table, and then you go home, right? So it wasn't as emotionally taxing that way. I know when you mentioned earlier how they say this is the easiest part of it, for me it was, because the rounds of chemo were so difficult. And so it was, all I've got to do is show up. I know I'll be tired, but I can deal with that. I can take breaks. I can, sick time at work. I can take time off and do what I need to do. And by then I was much better at asking my community for help and expecting it to show up and have people help with meals and things like that. So that took some of the burden off of me. But it also felt like the finish line. So again, I was a little bit excited to be like, okay, we're almost there, 1 more day or 5 more days or whatever it was to count down and get through. And then it was just relief for being done, and we moved right into maintenance therapy after that. But, that still felt manageable, I guess.
Excellent. Thank you. 2 more questions. I keep coming up with questions. It's such a great conversation. I really want to talk quickly also about quality of life. And then the next question I have is around how do you know it's working? So again, given the experiences that you guys are sharing today, how has radiation impacted your quality of life? How about Sara, we start with you?
Well, that's difficult for me because after radiation, the surgery and the radiation, I was put on the Tylenol of seizure medications, is what it was called. 6 months later, I was supposed to have the skull piece put back in. But again, those pesky infections kept coming up, and so they didn't put it in. And then 6 months after that, I had a series of seizures. And I still, to this day, kind of am in a series of seizures. So they have me on 4 different seizure medications, which is the most that they will usually prescribed to anybody. And so it's not really radiation that's my problem. Now it's the seizure medication and that sort of thing. So granted, radiation took a hit on my brain. I can still see on my images, I can still see the hole where the tumor was, and I can see, the place where it was radiated, but I don't know that it's necessarily the radiation that's as bad for me now as it is the seizure medication.
Sure. And then after going through the radiation treatment, because I know we're talking about like a specific treatment experience that you had, just out of curiosity, how did you and your doctors confirm and know the gamma knife radiation, and how are you doing today?
I loved my doctor. He was fantastic. We met I think for a while it was every 2 months, but it was every 3 months, and it was every 6 months, just how that goes. And I loved him. He did a great job of explaining and, talking about the images and how the space was closing up and, having me do different tests and, like walk like this and move your arms like this. And so it bolstered my confidence that things worked and made me feel that things were going well, as well as the fact that when we first, and I probably should have said this at some point earlier, but when we met with him the very first time, he was completely honest and gave us the statistics for someone who would have undergone this procedure and had this happen. And they were not great. And that's part of why it was scary. And so, now I can look back and I can say, well, I've far exceeded those statistics, those expectations. And that makes me feel like, okay, hopefully, knock on wood, wherever I have one, that I'm good and I'm past it and it will stay that way.
Amazing. Thank you. Joyce, what about you? So even hearing some of your experience that you no longer have this pain, I think is the physical side of the radiation doing its job and being successful. But you mentioned you also being like tired and fatigued. Can you talk to me just a little bit about the quality of life going through the treatment and then how you're doing now?
My quality of life through the treatment, yes, it improved greatly by the time I was done with it and the pain was gone. I mean, that was just huge. And yeah, it also makes it very obvious, right? Whether or not it was effective, that's an easy call. And that it hasn't come back because they said it could. So that's because that was early on, and I just got through birthday anniversary 4, right? My quality of life in terms of cancer and cancer medication is good at this point because the Verzenio is effective, but it's not causing me too many side effects. That took a couple of years to figure out, and it is still first-line treatment. So I'm celebrating that every day. I open my eyes and I'm like, still on the Verzenio. What's interesting is the stuff that causes my quality of life to be not so great is related to how other people perceive my ability or inability to do things because of my cancer. So it is side effect related, but it's more interpretation of my side effects than it is anything else. And it's not even somebody, it's not even a caretaker, it's not even a family member. It's somebody that has all kinds of power over me because it's related to my housing. And if you lose your housing, so I don't think that happens to a lot of people. I hope it doesn't, but it sure is a kick in the butt when it does. So, and it's so unfair because I have sent in all of the paperwork. She knows what's going on. I've always been honest with her about my situation and what I can and can't do, and it doesn't change anything. So it's sad.
Wow.
Sad. We'll fix it though. I'll get it somehow. I'm going to win this one.
Yes, absolutely. And I'm a little speechless as well because, after this recording, we can definitely talk. I definitely think there's an area of, cancer and housing and homelessness that because there's a huge link, not just with like the financial toxicities, but specifically like basic human needs and housing. So more to come on that passionate topic of mine as well. And
I'll show up for that
thank you for sharing that. I'm
too.
glad your pain is
That podcast.
Yes. Oh, you might be a guest on it. We'll talk about it. Yeah. And Kacie, I loved your enthusiasm. Absolutely. And Kacie, I loved your enthusiasm about, we're going to go tackle this. This is the first line of treatment is the radiation. you talked a little bit also early on about, being careful about like, oh gosh, the quality of life of like, I'm so fragile now and I don't want to break bones. And I know not just through the radiation, I know several of us are also, osteopenic or going through osteoporosis, given a lot of the drugs and medications that we're on. And just like, I feel like, why am I so frail? And I don't want to break anything. But tell me again, after you had the radiation, were there follow-up like scans or tests, or how did your doctors know it was successful? And how are you doing today?
I think, well, again, the order of the treatment with the SBRT being first, then we went into the chemotherapies, right? And everybody gets scans when they're doing chemo, maybe halfway through to see how things are going and see if the chemo's working. The first scan we came through, or that we had after starting chemotherapy, you could still see the liver mets, but they weren't lit up. So the contrast was not attracted to them. And when they showed me the scans, because my nerdy brain was asking to see the scans and the images as well, Sarah, like you had mentioned, that's what they pointed out. They were like, look, it's you can still see them, but they're not lit up. So they're effectively dead, and they're just have to wait for the body to absorb them, kind of. And then subsequent scans showed them getting smaller. And then there was one scan where they were just gone. And it was like, woohoo, we won that battle.
Wow,
That was worth it. Yeah. So that was how we knew it was working, was just from the imaging and it slowly disappearing over time. And yeah, mostly my long-term side effects of the radiation have just been the scarring in the skin area. And then we did have a lot of scar tissue, and I ended up having to do physical therapy and some sort of like myofascial release sort of work on the outside, because the skin had basically scarred to my ribs. So certain places, raising your arm or doing things, kind of had a lot of pain associated with it. But the physical therapy was able to loosen that up. And again, now it's just sort of avoiding hugs. So if we were to hug, my elbows stay at my side, and I kind of hope you go up around my shoulders, and that way you don't
Yes.
accidentally get me. But it's also taken a few things away. Like I can't get massages now, because even though I was going to an onco massage therapist, when she pushed, it caused my bones to shift and rub against each other. And that was enough to be like, yeah, we're not going to do this anymore. It wasn't super painful, but it definitely scared both of us when it happened. So maybe that's a first world problem, to not be able to get a massage anymore. But, it's pretty minor to not being here to experience it at all. So, yeah.
Well, hand massages, feet massages, other body.
Yes.
Amazing. Well, ladies, I really appreciated today's conversation, you sharing your unique and diverse experiences with radiation. I know I learned a lot. I know our listeners were probably on the other end of this call going to be shaking their heads and listening, and just knowing that whatever they're preparing for in terms of radiation therapy, that they have your stories and words of wisdom and hope and guidance of what to expect. So thank you for your time today and being here.
You're welcome.
Thanks,
Laura.
And thank you, everyone, for listening to our show. I would like to acknowledge that all of the information on our podcast is from personal experiences and is not a substitute for professional medical advice. You should always contact your medical care team. If you are looking for specific topics or would like to be a guest on our show, please feel free to reach out. My email is laura@survivingbreastcancer.org. Our show is made possible by our nonprofit, survivingbreastcancer.org, and by our incredible donors like yourself. You can hop on over to survivingbreastcancer.org to sign up for our mailing list, make a donation, and explore the 400 plus programs we offer each year at survivingbreastcancer.org/events. Until next time, keep on thriving. And thank you, everyone, for listening to our show. I would like to acknowledge that all of the information on our podcast is from personal experiences and is not a substitute for professional medical advice. You should always contact your medical care team. If you are looking for specific topics or would like to be a guest on our show, please feel free to reach out. My email is laura@survivingbreastcancer.org. Our show is made possible by our nonprofit, survivingbreastcancer.org, and by our incredible donors like yourself. You can hop on over to survivingbreastcancer.org to sign up for our mailing list, make a donation, and explore the 400+ programs we offer each year at survivingbreastcancer.org/events. Until next time, keep on thriving.